Hey guys, I'm going to talk about two really important minerals in depression, okay? So if you're depressed or you know someone who's depressed, have them watch this video. Okay, so let's start with chromium. If you research chromium depression, you'll get a lot of data, a lot of research on the connection between chromium and depression, but they don't really tell you why it works. And there's also, if you type zinc and depression, you'll see a lot of other data as well, but they're not really telling you why it works. And the reason why these two minerals are very effective is because they both are intimately involved in stabilizing blood sugars. Chromium helps the blood sugars become stable. A lot of diabetics, pre-diabetics take chromium and they do very well. If you're going to take chromium, you want to do 600 micrograms per day, okay? And zinc is necessary for the production of insulin. In fact, the cells that make insulin absorb a lot of zinc. Out of all the cells in the body, most of the zinc is in these cells that make insulin. That's called beta cells in the pancreas, so that's interesting. So if you were going to use this, I would recommend 30 milligrams. Okay, so these two are really, really effective. So let's go a little bit further. If you look at the blood sugars, and let's say you have low blood sugar, okay, because the insulin is high, because you have insulin resistance, and the body's just making more because it's not connecting. Okay, so you might have hypoglycemia or a subclinical version which doesn't always show up on a blood test. Now, the brain is the #1 target for hypoglycemia, and the question is why? Well, because the brain does not store sugar like the liver and the muscles. It doesn't have glycogen, so it's dependent on the sugar in your blood. Okay, so if there's low sugar in the blood, the brain suffers big time, and your mood goes straight down. And you have another factor of insulin resistance, which is behind this whole cascade, which is involved with not absorbing a protein that well, not absorbing amino acids, which are necessary for the building blocks of neurotransmitters, like dopamine, serotonin, like GABA, all the different neurotransmitters that elevate your mood. So we really have a double-edged sword with this depression. So these are just two minerals that you can take in addition to doing keto and intermittent fasting. Thanks for watching. Hey, tell me what you think about this video. Go ahead and comment below and give me your feedback.